So welcome to this Great Lakes ROTA-RC presentation. Today's webinar is Integrating Farmer Needs into Childcare Solutions. This webinar is being hosted by Great Lakes Rural Opioid Technical Assistance Regional Center, regional partner, Ohio Youth Resilience Collaborative, and OSU Extension. I'll be your host, Kelly Cabral, and I'm a project director with the Ohio Youth Resilience Collaborative. Before we get started, in the presentation, we have just a few quick housekeeping items to address. So first off, let us take a moment to acknowledge our funder and funding activity. The Great Lakes ROTA-RC is funded by Substance Abuse and Mental Health Services Administration, known as SAMHSA, to provide training and technical assistance to the rural communities within the Great Lakes. Collaboratively, we develop and strengthen community capacity to prevent, treat, and support recovery for opioid use disorder and other mental health conditions and substance use disorders. Through cooperative extension state programs, we employ evidence-based emerging practices and provide virtual and/or on-demand education for rural community members regarding substance use education and other relevant topics, such as what we are discussing today that have to do with mental health and well-being. In communities with Indigenous populations, the project co-creates culturally responsive, holistic health education and resources. We also provide evidence-based resources and research, as well as technical outreach to professionals working in and with rural communities. I do want to point out, too, that our goal is not only to provide these educational opportunities, but also to build a toolkit for community resiliency. So after this presentation, we will invite participants to send us resources or tools related to today's topic if you feel inspired. And then we will disseminate a toolkit after the seminar so that we all may become better practitioners with wider and deeper resources at the ready. We are continuing to build on the learning from our prior seminars, and we'll continue to weave themes of prevention, community resilience, and hope in our future seminars. We also invite you to learn more about the Great Lakes Rural Opioid Technical Assistance Regional Center, its resources and partners by participating in our grant products. You can see here on our website, we'll make sure you all have a link to that as well. We have all kinds of previous seminars that we have offered, like this one today, recordings and toolkits available on the website. We also have a newsletter that I would encourage you to sign up for. Again, we can make sure we get that information spread out to everyone. And that gives you information on upcoming events happening throughout the region that may be available to folks in Ohio as well as other states. And then as we prepare to listen and engage in this session content, let us take a moment to promote the use of affirming person-first language when discussing behavioral health disorders. As we create an environment of learning together, let us create a learning space that is welcoming and safe for everyone. As a virtual learning community, we ask that all participants support non-stigmatizing, recovery-oriented language that can help reduce negative bias and promote engagement. And with that, I am pleased to introduce today's speaker, Dr. Shoshana Inwood. Dr. Inwood is an associate professor and rural sociologist at The Ohio State University. Her integrated research and extension program is funded by USDA and CDC and employs both qualitative and quantitative methods to understand, 1, economic and community development through food and agriculture, 2, the ways in which access to affordable, high-quality health childcare, healthcare, and health insurance affect economic development and quality of life in the agricultural sector, and 3, food system resilience in disasters and disruptions. Dr. Inwood was a faculty fellow with the North Central Regional Center for Rural Development, NCR-CRD, and led the 2023 Caregiving Across the Life Course survey. She has extensive experience with farmer surveys and has a strong national reputation for highlighting the importance of household factors in driving farm viability and social sustainability. So welcome, Dr. Inwood.
Thank you so much for having me. It's really a pleasure to be here. And since this is actually a relatively small group, it would be really nice to make sure that this is really interactive. And maybe we could start out with, if you could just type in the chat your name, where you're from, and maybe what you're really hoping to get out of today's conversation. And at the same time, as I'm moving forward through any of the presentation, especially because we're such a small group, if you have a question, please feel free to unmute and ask that question, okay? All right. I'm going to share my screen, which is always the moment of truth. Okay. Can we see it okay? Great. Okay. So thank you, Kelly, for that generous introduction, and to both Kelly and Pam for inviting me here today. And really, when I was getting ready and talking with Pam, thinking about this, how can it be most useful for this group today, and all of the work that you all are doing. So the objectives today are really to think about and learn about how childcare can create stress for farm families, because I know a lot of you work on issues around mental health, and also the connections to even opioid issues. And that's actually how some of this work got started, when families where grandparents who were losing custody of their were parents who were losing custody of their children, and those kids were going to live with their grandparents, and a lot of the struggles with childcare that these folks have. So really understanding some of these reverberating impacts, and understand how access to quality, affordable childcare can affect farm safety, farm economic development, farm stress, and farm family quality of life. And then we're going to spend some time actually talking about some of the tools that we've been developing to help start conversations and integrate childcare into whole farm planning, and also to learn some tools that can help you integrate farmers into larger conversations that might be happening in your community around childcare, and how do we actually get this into the larger conversations. Great. Okay, so the way that I'm going to do this is actually talk a little bit first about social sustainability in food and agriculture and what that means. Then I'd like to share with you some of the research that we've been done, as Kelly mentioned, that's been funded by USDA and CDC, and then actually go into those different tools. So one of the big issues, how many folks know what percentage of the population are farming today in the United States? Does anybody take a guess? Somebody shout it out. Take a guess. What percentage of the population is farming?
5.
5. Yeah, it's actually less than 2%. 2%. All right. And what's the average age of farmers in the United States? 60. Anybody else? Close.
65.
65. So it's actually 58.9. Right. So we have an aging and shrinking farm population, and that's a big concern about who's going to be providing the nation's food, fiber, and fuel. And recognizing these issues, USDA and also state governments have taken a lot of initiative to develop policies and programs that support the next generation of farmers. And a lot of those programs have really focused on access to land, capital, credit, skills, and market development, all of which are really important. But they also overlook some of the social and household level issues that are affecting farm families. And a lot of this work can really be thought of within, how do we approach sustainable agriculture, where there's a lot of talk about economic and environmental sustainability. And a lot of times there's also those issues are really pretty easy to understand and operationalize. And then we talk about social sustainability, and that can be a lot more confusing. A lot of time it's actually lumped in with economic profitability. If farms are just more profitable, then they'll be more socially sustainable. But that's really not the case. And social sustainability can be really opaque and hard to define. And so a lot of my work has really tried to work in this space, especially around these issues around health insurance and childcare, and wanted to share with you SARE, the Sustainable Ag Research and Education, has really tried to tackle this head on. And what does social sustainability mean in agriculture, with the new publication that came out last year. And we'll make sure that you all are available, have that available, because it may be useful for some of the work that you're doing in rural communities. So when we're talking about a farm, right? The majority of farms in the nation are actually family farms. And this really applies to any family business. The farm and the enterprise are deeply intertwined. And there's a lot of exchange of resources, both in terms of time and energy and money. But what's happened is that over time within agricultural economics, we've really tended to separate out the farm enterprise from the farm household, right? And we only focus on that farm enterprise and don't think about those exchanges, even though there's been decades of rural studies that have demonstrated those deep interconnections and interreliances. And particularly, we know within the farming community how important off-farm income is for providing economic stability, especially with, very challenging markets and weather conditions. And primarily also somebody within the family is working off farm for benefits like health insurance. And so what my work has really tried to do is really try to understand how are these interconnections and interreliances between the family and the enterprise within the household actually affecting farm profitability, resilience, and quality of life, and really focusing on the issues of health insurance and childcare. And today I'm only going to focus on the childcare piece. And these again are really have long been invisible issues when we're talking about efforts to support American agriculture. A lot of times we focus on the success or failure of a farmer based on if they're a good producer, they're a good marketer, they had good it's like bookkeeping skills. And we forget that individuals are also embedded in larger social systems, ecological systems, economic systems, and government systems. And when there's major policies, whether we're talking about things like the Affordable Care Act or child care policy that are happening at the national level, those are going to have reverberations through the farm community. And so it's really important to understand what those implications are. So when we talk about farm safety, in particular, this has been a big issue within the agricultural community. So farm safety experts have a lot of great data that they've been looking at how dangerous farms are. They're wonderful. Farms are wonderful places to grow up, but they are also involving lots of heavy equipment. They also involve animals, right? There's lots of hazards on the farm, ponds when kids are being watched or when they're not being watched. And some of the statistics are that every 3 days a child dies on the farm, and 60% of agriculturally related injuries are sustained by non-working standing children, which means that they're not necessarily working on the farm, right? But they're, playing out there. And so for over 25 years, farm safety experts have said the safest place for kids on the farm is actually off the farm work site. But they've never asked farm families, what are your childcare options? And this becomes really significant because we know that even before COVID, 3 in 5 rural communities were childcare deserts. Right. And so what kind of access do families have and what kind of options do they even have is an important question that we actually need to explore and dig into a little bit more. One of the other things that we know is that the availability and quality and cost of childcare is going to, affect farm productivity, the division of labor, how the farm is laid out, and what types of marketing channels can even be pursued. And that has really broad implications both for larger farm economic development at a more macro level, but also at the individual family level and their family's well-being. Any questions so far? I've got the chat open, so just looking. Okay. So some of the things, again, I mentioned that it's a really wonderful place to grow up on the farm. There's lots of really great opportunities. And a lot of times, right, when we're looking at magazines or we're in the grocery store, we see a lot of these kinds of beautiful images, right, of children working on the farm, right, like really ideal. And we don't often see the other side, right? The pictures of how challenging the day can be when you're taking care of children, no matter who you are. Does anybody have kids or is taking care of kids and is able to relate to this photo? I see some hands like, yeah, this really, I think, resonates with so many of us, whether we're farming or not. So one of the things, right, wanted to actually just spend a moment doing is let's talk about what are the things that you're seeing in this image, right, that the way that juggling farming and taking care of kids can affect individuals' mental health, parents' mental health, caregivers' mental health. What are some of the things that you're seeing in this image? And you can unmute.
I'm feeling isolation, Dr. Inwood, because they must feel so overwhelmed, and my jaw's dropped already thinking about childcare deserts and the injury to children and families and the consequences of this as a profession.
Yeah. So that definitely the parents are overwhelmed and definitely. Thank you, Pam. Others? Anybody else want to
In the
unmute?
chat, I see having to search for childcare instead of easy options already available.
Yeah, yeah, right. And let's say well, here's another question. Does the dad, we're gonna assume that this is the dad in the picture, the dad knows what the mom is Googling? Maybe, maybe not, right? Sometimes those conversations are really hard to have, where one partner may be experiencing something that the other partner is doing. I mean, he looks overwhelmed, but who are all the kids coming towards?
The mom.
The mom, right? So, right, it's really also important to acknowledge that even though there's two parents, like there may be multiple, individuals within the household taking care of kids, what we see is that a lot of that falls onto the mother, right, and onto the woman, and that there's this disproportionate impact on the mental health for women, and because they are so often in those primary caretaking roles, right? And so like we see the kids are cooking, right? We want our kids to be independent, of course, but they're still kids, right? And the pot's boiling over and they may need some additional help. And then also here we see some farm safety issues, right?
Look
Maybe
out the window.
happening.
Look out the window. Someone's about ready to get plowed over by the whatever that
Right?
is.
Yeah, yeah, right? Having fun outside, right? And then like the devices. So there's a lot that's happening, right? Because farms are also really busy. And right, and this is, you ever see those images in Better Homes and Gardens for those beautiful farmhouse sinks and the idea of what the farmhouse kitchen should look like? But this is actually what a farmhouse kitchen can also look like, right? Dishes are piled up, those things have to be taken care of, right? And those are all these everyday stressors, right? That can compound. I'm sure we all can relate to this as well. So let's also talk about what is childcare. Just really quickly, how do folks actually think about and conceptualize what is childcare? You put that in the chat or share it out.
I would say support. Childcare is support for me to be able to be outside my role as wife and mother and to be engaged in gainful commerce.
Yeah, that's a great definition. So like this idea of having supports, right? And so that you can do things in addition to taking care of the kids outside, kind of outside of the home. Anything else? Any other ones? Definitions? Safe, nurturing environment. Could be informal, just having more adults around. Yeah. What located? These are all great definitions. And what I'm also really loving about your definitions is that you're not excluding it to one age group, because a lot of times we think about childcare in those very early preschool years, but really childcare is much more expansive than that. And what you've all touched on is that it's both physical work, there's emotional work involved. It's really about caring for kids from when they're newborn and even prenatal through adulthood, right? And it's done by a wide variety of people. It could be formal, it could be informal, right? Lots of different things, lots of different people who are contributing to taking care of children in many different ways, right? Again, it could be folks who are related to you by through family, or it could be friends and neighbors, and it can also be schools. And one of the important things, right, again, to recognize is just because children age, their childcare needs don't go away, they just change. And that same can happen with stress, right? The stress that's associated with taking care of children doesn't go away, it just changes. So while kids are really young, maybe farm parents might be concerned about kids running in front of the tractor, right? And then when they're 15, 16, you have to be concerned about what's happening while they're driving the tractor, right? So these things, again, are very, very fluid. So having a nice, big, broad approach to childcare is really where we're coming from. And then when I first started doing this research about, oh my gosh, 15 years ago, I got a lot of pushback from a lot of folks within extension, technical key informants, right, who were like, what do you mean childcare is a problem? That our farmers don't talk about that. So one of the first studies we did was actually to say like, well, like, is it even a problem? And there's two really interesting parts. One is that there's actually evidence going back to the 1980s where farm women were asking for help with childcare so that they could pursue their agricultural careers. And then from two studies that I did in 2014 and 2020, we see consistently that 2/3 of farmers nationally are reporting challenges with the affordability, availability, and quality of childcare in their communities. And men and women are reporting that they experience childcare problems very similarly. But where we do see some differences is in this idea between multi-generation versus first-generation farmers. So first-generation farmers are folks who don't have any prior background in agriculture. They're not inheriting a family's farm. They're moving to locations where it may be determined by soil, access to markets, and not necessarily embedded in a community, which is where so often we get so many of our childcare supports. But it's even though multi-generation farmers have slightly less of a problem with childcare, you can see that over half still do, right? So just because you're in a multi-generation farm family, it doesn't mean that you have no childcare problems. Okay, so much more recently in 2021, my collaborator at Penn State, Florence Bacot, we did a national survey of farmers that in all 47 states of the United States, to really understand how this issue is impacting them much more broadly, and especially post-COVID. And what is really interesting is that we saw that 3/4 of farm families are reporting childcare challenges within the last 5 years. Almost all, 97%, are worried that their kid could get hurt on the farm, but they lacked alternative options. Almost half, 48%, said that affordable childcare is important to the economic viability of the farm business. And 3/4, 77%, report that taking care of children affects their ability to get the farm work done at least sometimes. One of the other really surprising pieces of information that came out of this study, both when we were doing focus groups with farmers across the country, and then also in this this larger data set for the household survey, was that almost half of the sample reported that someone in their household experienced pre or postpartum depression. And there's been a lot of focus on farmer mental health. And oftentimes that's much more related to production issues and marketing issues and weather issues. And we don't acknowledge that pre and postpartum depression is as much of an issue within the farm population as it is within the general population. So that was really significant. And the other thing that I think that's really interesting about this particular study is when we were trying to recruit women to participate in the qualitative part, we were hoping for 35 women in the 3 states of Ohio, Wisconsin, and Vermont. And we gave ourselves 5 weeks to recruit. In 5 days, we had 108 women sign up to talk. And so we did 13 focus groups. And so farmers really wanted to share what their experiences are with childcare. A little bit of a divergence here too, because I know that you all deal so much with health issues and opioids. I wanted to just intersect a little bit about how health insurance goes into this equation with childcare, particularly for farmers. So we know that access to quality, affordable health insurance is critical because in the United States, the way that we really access healthcare is through health insurance. And I have a lot more data on this, so I'm not going to dwell on it, but I wanted to zoom in on some of the issues that we found when surveying 18 to 35-year-olds. So those are those young farmers who were really trying to train because they have strong young backs, but this also overlaps with their prime reproductive years. So some of the things that they shared with us when it came to health insurance is that farmers really appreciated being able to be on their parents' health insurance until they were age 26. And when they were approaching 27, they felt like that they were going to be coming to a cliff because they knew that farming is a really hard occupation that's hard on their bodies. And so that they really see this as part of their risk management tools. 2 out of 5 are enrolled in public health insurance programs. And what became really clear is that for young families, there's some really difficult decisions that need to be made. So what we found is that some farmers were actually maybe themselves as adults were underinsured while making sure that their children could be insured through any of the CHIP programs, the child health insurance programs, and really prioritizing that. Those programs are determined by your income eligibility. So what we found is that farmers were thinking, could I get an off-farm job that would provide me with additional income that I could really use to help support the farm business and the household, but that would raise my income where I am ineligible for CHIP anymore. And at the same time, I now have to figure out what are the childcare, who's going to provide childcare, and the costs of childcare are so expensive, right? Or I could get an off-farm job where there's health insurance benefits, but again, who's going to pay for childcare? So we heard from a lot of folks about how you're really betwixt and between in this very difficult spot, and how these issues of childcare and health insurance really go hand in hand. And when we were doing these focus groups focused only on childcare, when we asked women at the end, what are some of the other issues you'd like us to address? They all said health insurance, right? So these issues are definitely intertwined. When it comes to policy, what's really interesting is that we saw that farmers across the board really want both USDA and farm organizations to represent their needs and interests in national health insurance and child care conversations around policy. So there's a real appetite for this out there. So I wanted to also just share with you some of the visuals, because there's a lot of facts and figures, but I think that there's really a human side to this as well that's really important to see. And one of the things that we did as part of this project was we asked women to take pictures of their real life experiences in response to a couple of in response to a couple of questions. This is called Photo Voice. And so these are all pictures that women took, and actually all the pictures that you've been seeing so far are ones that women took. And then they helped curate a photography exhibit, which we have as a traveling exhibit. And if you'd like to host that in your community, I'm happy to help bring it to your community. But some of the things that we saw were not just the joys, right, of raising kids on the farm, but then also what is the strategies that farm families are using to keep their kids safe, right? And some of these are, I think, I'm really curious to hear your thoughts about them, right? Because this idea, right, some jobs are supervised from a safe place. So the importance of putting hearing protection on, but also sometimes you need to put kids in a safe space on a farm site, which could be inside the cab of a truck. We heard a lot about the use of also iPads and screens to keep kids safe. We heard from so many different families, kids who had special needs. So we heard from families who also had children who were adopted, foster kids, so different social, emotional, and physical needs, and this broad range of different types of needs and strategies that folks are implementing on the farm. We also saw women really also very openly shared this idea of what is the triple burden, the stress that comes from taking care of both the home, the children, the farm work, and the off-farm work, right? And I think people were really like, this is what my real farmhouse kitchen looks like. You know, the vacuum cleaner is in the kitchen. I felt much better about my kitchen when I saw these pictures, right? Because sometimes I think there's this ideal, especially with social media, right, of what is this ideal world that we should be living in. You know, showing the need for working off farm and taking shifts and being at the hospital and being at the mercy of your in-laws for when they might be available to take care of the kids, and not always being able to trust your partner to take care of the children either. And then this idea of cooking, right? And that even though, right, how much of a chore cooking can really be. When we also really saw people were very honest about the stress, right? The mental health impacts of how it feels to juggle children, farm work, and taking care of the household. And people just shared how stressed and anxious and tired it really made them feel. And I guess I just want to stop here for a moment and ask if anybody has any strong reactions or things that they want to share about after looking at these images. You
I
add in
can
the chat.
share. This is kind of my life. Can you hear me?
Yeah.
I'm from near Oxford, Ohio, and I live on a farm raised my 4 children on a farm. I was a nurse, worked at the hospital, the night shift, and tried to find sleep the next day. So yeah, it's very stressful. I did have, I'm in a community. I had some neighbors, some high school girls that I had babysit so I could function. But yeah, it's very stressful. Thank you for bringing it to the forefront.
Well, Marcia, thank you so much for sharing your experiences. It's how do we make the invisible visible? I think is one of the things. And now that, you know, I will say that one of the things that I want to transition to now is how do we have tools to help folks make decisions? Because over the years, I was getting increasingly embarrassed that you know, I can go to conferences and say, this is a really big problem, but I have nothing to help you make decisions, or, that's not very useful. So we received some funding from North Central Region SARE to actually develop curriculum around decision-making around childcare, healthcare, and health insurance that educators and farmers can use to insert into their whole farm plan. Because you know, that's also one of the challenges that we also heard from farm technical assistance providers is that, you know, we're starting to see that it's an issue, but we really don't have any tools to be able to talk about it. And if you don't have the tools and the resources, you don't know what to do, and that makes it really hard. So we wanted to provide folks with these tools and create a space. So these are two different modules that we created, and where we are in the project is we just trained a cohort of 20 educators across the North Central region to actually test the different tools that we've developed. They're testing them this winter and validating them. And once we hear back and make some adjustments, we'll be releasing this curriculum nationally. But I do want to share with you some of the different types of things that we're going to have available, and some of which are already available. Some of which in terms of health insurance, some of you may know the Smart Choice Health Insurance curriculum that comes out of University of Maryland. And we've adapted a lot of that to really insert into decision-making specifically for farm households. And understanding also how health insurance costs, can they come out of the household budget, and also how can they come out of the farm budget, to give some folks some other ideas about that. And then in terms of childcare, really we've developed a number of different tools and resources around how do you think about this very challenging equation, right, of different time, money, and energy resources that you have to balance when figuring out how to take care of kids. So I'm going to share with you some of these childcare ones that we went through. And I think the thing that you'll keep noticing is that you'll see a lot of puzzle pieces. And as Marcia alluded to, right, there's no one solution, right? A lot of this is really figuring out different pieces and parts and what's going to work best for you and your family based on the different values that you have. So some of the things that we really want to be honest about is that there's different trade-offs, right? In time and energy and resources, and how much you are able to dedicate to your family, your farm, and then any kind of off-farm needs as well. And family can be very expansive too, right? It can be just a super nuclear family. It can also be an extended family that you're thinking about, and other caregiving needs that you need to fulfill, especially for the sandwich generation that may also be taking care of elderly family members or friends. And so some of the things that we really ask folks to do is think about how is the family and the farm actually interconnected, and where are some of those tensions arising, and what's causing you stress, right? How do we start to talk about these things? So we have a series of different questions that we ask folks to fill out. And we really try to acknowledge, right, that this is complicated, right? That there is no, again, one answer, but that childcare is going to affect your own well-being, right, as the adult, your children's well-being, because if you're in a stressful situation, your child is going to feel that stress as well, right? It can affect your farm success, and that families are complicated, right? There may be that there's some people in your family that you absolutely 100% trust with your children, and there's other people who you might say, I will never leave my kid with that person, right? So acknowledging also when there's, you know, divorce, right? Can be abuse within families. There's a lot of complexity in there that's going to affect the decisions that you're making. We also are really trying to emphasize that some of these issues really are not an individual's fault, right? Like it's not that you're bad at trying to find childcare. It's that it's really hard, right, to find providers, and that this is really also a structural issue, particularly when we know that rural areas are childcare deserts, right? Childcare is hard no matter where you go, but especially in rural areas, and it's very expensive, right? And so again, knowing that your childcare needs are going to change over time, right? And what's working today is not going to be the same solution that you need in 5 years as your child ages. So to really provide that space to recognize those things and give some folks a little bit of grace on those things. Right, so there's no one perfect solution. So this is another one of the cartoons that we use in the curriculum, and asking folks, you know, why is childcare an ag risk management issue? So what are some of the things that you see happening in this particular image.
There's a child who must need an EpiPen for a bee sting. That's the first thing I saw.
Yeah. Yeah.
Very risky to be around the bees.
Yeah. Right. That can be lethal, right? If you don't.
Yes.
Yeah. Yep.
A
Great.
distraction is about to occur because there's a child running with a phone.
Yeah. I'm sorry, wait, Pam, I missed the first part.
A distraction is about to occur.
Oh, because of the phone, the running with the phone.
In the-
I think, sorry, I think that they had a plan in place with walkie-talkies, but she's not hearing it. It looks like she has a walkie-talkie in
Oh,
one
yeah.
Yeah.
walkie-talkie.
Yeah.
In the chat, I see teenagers watching kids.
Yeah. Yep. I love how that's a question, right? Because sometimes, like, I know this happens with my own family where I have my older kid watching the younger, and sometimes they do and sometimes they don't, right? Yep. Was there somebody else? Katie, were you unmuted? Did you want to share? Maybe. So a lot, right? A lot going on. So we have this like a potentially dangerous situation, and right, there's a physical barrier, right? So as you know, we're gonna say that this is the mom, and so thinking about farm safety, what are the ways that she can try to create a safe space to work, right? Using the walkie-talkies, using a physical barrier to say, this is the safe spot, don't do this. And we have a toddler running forward. So will the toddler stop or not? We don't know, right? Then that's the thing with toddlers, right? And another child trying to help out. And so what's really the other significance, what do you notice about the background too? Okay, thanks, Katie. Did you want to share something? Oh, it's loud. Okay. What do you notice about the background also?
They might be close to some resources that could help them if that's a city.
Yeah. So yeah, so what's interesting, right, is that it's a city, and really like the emphasis is that it doesn't matter what you grow or where you grow it, right? These are issues that affect farmers, whether they're farming in rural, suburban, or urban areas, right? And you could be farming on a very small scale or a very large scale. And these issues are resonating across the agricultural spectrum and across the agricultural economy. Yeah. And there could be more resources there, right? And again, we know that still, even in cities, that childcare is still very difficult, right? So yeah, so Pam, thank you for bringing those up, right? So these were all really great, great observations. And so these are some of the tools, right, that we're asking to have farmers help talk about things, right? Because sometimes it can be very hard to talk about your personal situation, right? So how are we using these images? Because everybody sees something different in them. So some of the other things that we also really try to emphasize is the way in which childcare issues really are ag risk management, because it's really at the intersection of an interconnection of the family and the farm enterprise, right? And so, right, we know that the safety of children is always of the utmost importance. And we know, though, especially from all the data that's out there, that caretakers can get distracted and they can put themselves and children in peril. And that is why childcare becomes really important. From a legal liability perspective, if you or someone else's child is injured on the farm, you could potentially face liability issues. And you yourself can also experience feelings of guilt that are very difficult to recover from. Right. And caretakers themselves can experience stress and exhaustion managing caregiving, farming, and an off-farm job at the same time. You know, trying to keep your kids safe, especially one who needs an EpiPen while you're also tending your hives, is probably a very stressful situation. Right. So this kind of contributes to this really sticky set of questions of how are we able to value both the physical and emotional work involved in caregiving, right? How do we make time for that work? And how are we putting these needs into our ag risk management plans? So the other part is that we're also really working on emphasizing is that farms are businesses, right? Especially if, you know, these are family-based operations a lot of times are small businesses, but they are businesses. And it's really important to recognize that childcare is also a cost that's connected to working in the business, right? And there's some costs that we don't always factor into a farm plan. So for example, if you have a garden, a big garden every year on that you really rely on to help feed your family, you often don't factor in the cost of your labor needed to maintain that garden, right? It's an in-kind work. It's part of the informal economy. And historically, and still for some families today, childcare has been outside of the cash economy, where family members have not always had to pay for watching children. But for many, those things are really changing, right? We don't always have grandparents, aunts, uncles, or cousins living down the road who can easily watch the kids. They may not be living nearby, or they may be working themselves, right, in other jobs, or they just might not be interested and available. So increasingly, childcare is an expense that we need to pay for. And so if you're not going to incorporating the cost of childcare into your farm plan, then you're not going to have money to pay for it. So again, figuring out childcare involves making decisions about these trade-offs in terms of time, energy, and financial resources, because there's opportunity costs for whatever you decide. So for example, if you're watching children instead of arranging childcare, will you have enough time to farm and market the crops and livestock you raise, right? How is this going to affect the viability and growth of the farm enterprise? Likewise, how does the cost of childcare affect your production, labor, and marketing strategies and costs? And so again, because these things are going to change over time, it's really important to reevaluate how it fits into your ag risk management plan over time. So just some other resources. The farm safety experts have really taken this issue very seriously for a long time and have really come up with some great guides about called Cultivating Child Safety on the Farm, and have some really great resources to help parents with how do I create safe play areas on the farm, how do I engage non-working kids, for also different types of operations. So whether you're a dairy, livestock, produce, agritourism, some really, really great resources that are available there. And those are all available through our website. The other thing that we also try to focus in on is making sure that adults are thinking about themselves and not just their children's welfare. And how that can really impact their ability to be a good parent and be present for their children. How do they manage their farm tasks and farm needs and off-farm needs safely, right? And really thinking about how do we stay healthy by preventing illness or injury and any of those mental health stressors. And really trying to focus in on this quality of life, right? Because again, if farming is seen as a stressful, difficult occupation, right? No, the next generation is not going to want to go into it, right? And you may leave it. And in fact, we did hear from families who have these issues of childcare have led to divorce and exiting agriculture. So that is a very real outcome that comes from the stress associated with this. So some of the things that we do in this curriculum is also provide different case studies and tools. Like I mentioned, we also use a lot of comics in it, like that you've seen some of those examples. Also really trying to emphasize that because these are hard conversations, how important it is to set some time aside to be how to talk about these things, right? Some of those tips, and I'm sure that a lot of you work on and insert into your own work about how do we be positive, how do we be empathetic, how do we listen, how do we say how different things are affecting us, right? Because everybody in the family has their own perspective, two sides to every story. And also asking, are children part of the planning process, right? Do you want them to be involved? And also knowing that it can be helpful sometimes to bring in a third party, right? If you need a family counselor to negotiate some of these conversations, because they can be very difficult to talk through. So again, lots of different things. So we also really try to integrate some really active and engaged ways for people to understand what's happening on their farm. So one of the things that we ask folks to do is actually draw their farm. And think about the physical layout with the kids in mind. So this is just a sketch. And again, like, because you don't have to be a great, artist. You've got the barn, you have the house. Here's the main road. This farm has corn here, and there's a silo, there's woods and a stream. There's a chicken tractor and your vegetables being grown over here. So just really quickly, does anybody looking at this, thinking about if this family had young children, what might be some of the challenges with this particular layout? Or what are some of the things that are working well with this layout?
I hope that they can see the playhouse from the kitchen window. That's one of my dreams. I don't like the stream and the pond without more physical barriers or access points if they would be playing in a less supervised way if I'm in the silo or at the barn.
Yeah, great observations, Pam. Wonderful. Anybody else? So those are those are really, like, really important issues. So one of the things that might also be interesting to think about, right, is corn a very labor intensive crop? You seed it, you have to harvest, but it's not an everyday type of crop compared to vegetables and chickens, right? That are much more labor intensive. And these are pretty far from the house. So it might be worth saying, does it make more sense to maybe move some of these more labor intensive crops closer to the house, right? Where they'll be closer to where the kids are playing. I can run back. They'll be closer to bathrooms, right? And maybe we move the corn and less intensive crops to a far field, right? And in fact, we've talked to families who did actually think about their farm layout less in terms of the topography and more in terms of what's a near field and a far field that's going to be working well for our family, right? And these kinds of questions about hazards on the farm. Some of the farmers that we've talked to, the women said, I can get money for fencing to keep cows out of my stream. Why can't I get money for a safe playground to build a fence around and have a safe area? Right? Some really interesting different ideas, but these can help visualize and talk about different strategies. So the other tool that I think is particularly helpful is asking folks to develop a seasonal calendar that includes not just your production and marketing types of activities, but also mapping out what is your off-farm schedule, when is school in, when is it out, what kind of camps are available, what kind of seasonal health issues you might be facing in the family, when do you need to hire labor, what type of labor, are there conferences you want to go to, are there vacations your family wants to take, what are some of the other deadlines that you have coming up, when do you need to pick out health insurance? And then to also be able to identify when is income going to be high and when is it low, when are things particularly stressful, when are they a little bit easier. So for example, if you're going to farmers markets in the summer and you have very young children and there's no camps nearby and you have no family to assist them or watching the kids, and the farmers market sales are kind of up and down depending on the weather, right? You're like, is it worth it for us to do that, right? Or should we potentially be shifting into more season extension types of activities where we're really farming more in the months when the kids have school, because school is a form of childcare. And in fact, farmers shared that school, especially public school, because they don't have to pay for it, is one of their biggest, most relied upon sources of childcare, because they can get things done safely when the kids aren't around and they don't need to pay for it. So again, recognizing that your year is going to change as your production system changes and as kids' schedules changes can be really helpful. And then we have a series of sheets that I'm not going to go through, but that how are we actually going to map out what different children's and family needs are? How are we going to pay for it? Is this going to come from the household budget? Is it going to come from the farm budget? And so we have a series also of resource sheets that can explain different tax options and different types of strategies that you might use to see plug into your own calculations. The other tool I wanted to mention quickly is many of you, I'm sure, in your communities are talking about childcare. A lot of times what happens is the farm population kind of becomes invisible in these conversations at the community level. A lot of times there's focus, let's bring in the Chamber of Commerce. How many of you know farmers who are members of Chamber of Commerce? Like almost none. Right? So this sheet really helps you think about who are the different types of farmers and farm workers and processors, the whole agricultural economy really from farm to plate that you might want to bring in to your conversations, and helps you list it out. And we're going to give you the link to that, and I'll pop it in the chat as well. I just also wanted to mention really quickly in wrapping up that part of that curriculum, the whole farm planning, we also use comic books to talk about health insurance. We actually have a 6-page comic where we talk about a family. Some of the nieces have started a farm. One is pregnant. They go and visit their uncle and aunt, and they ask, "Oh, how's it going? And do you have health insurance?" They're like, "No, we don't have health insurance." And they're like, "What? You have a baby coming on the way. You want to lose everything." And then using flashbacks, they explain the story of how not having health insurance affected them, not just financially, but also their marriage, the social, emotional, having a baby coming on the way, caretaking, managing labor. So really finding ways to destigmatize talking about the stress in these situations and how it again affects not just the farming, but also the personal relationships of these things. And so really we have, on the back of the comic, and also for the childcare and health insurance where we're putting everything, there's a QR code, and I'm going to give you the website as well. But we have these out at different conferences, not just as an education tool, but really also as an engagement tool. Because sometimes you have to think about different things, see things differently, right? And think about them over time. So just with wrapping up, I think it'd be great if you could, any questions, but then also if you could include it in the chat, what's one thing you learned today that you're going to take with you? And is there an action that you will take with you today?
I'll jump in and start, and I know people are typing, Dr. Inwood. I typed in the chat the photo voice and the traveling display. I think that's just a phenomenally powerful thing. Since we do represent 6 states, I'm wondering, is there an online version of that?
Yeah, so there is an online version that we're just getting ready to release. We also do have, for those of you who are in Wisconsin, a couple of the states actually, so we had one set for Ohio, one set for Wisconsin, one for Vermont, and Penn State also purchased one. And so if you're in Minnesota or Wisconsin, we actually have Stephanie Plaster with University of Wisconsin Extension, who's kind of our caretaker, who can help arrange to get that to different locations. And really, we also have a media kit with it. We've got posters that you can use to help promote it. And the idea is it could go anywhere from, the county fair to your small local library to your post office. And so it's just 5 pop-up banners. And on the 5th one, we ask people to different questions. And so there's room for Post-it notes for people to interact and give their thoughts and feelings and opinions.
The other thing that jumped up in my mind was really that tension that you mentioned several times between the farm budget and the family budget. And it still is interesting, when I look at the dynamics of conversations in my generation, and then I have adult children, childcare still seems to come out of the woman's role. And it's interesting, so it gets deducted from my income. And then we have questions about, is that a worthwhile endeavor? Is it better time spent in the home or employed and pursuing a professional pathway or whatever it might be? But I like that intentionality that you have to bring those conversations together. So I think that tool would be very helpful.
Oh, thank you, Pam. Yeah, and I think that's right. Like, how do we kind of have a framework that says it's okay to talk about these things, right? And it's because they're such hard conversations to have.
And I'm not sure if you can see the chat, Dr. Inwood, I can read to you. Kelly said, I learned the rate of postpartum depression is nearly 50% on the farm households based on the survey. She plans to share those resources within her local food network. Another participant saying yes to that as well. Katie saying, I think Rural Action would like to eventually integrate insurance childcare trainings into our farmers into our programming. So that might be a link for them to pursue as they leave this session. Living in Southwestern Ohio, recently, Marcia states that the city nearest us offered a grant for childcare within the city limits. However, this is not applicable to the nearby rural area. So seeing that disparity, are there resources and grants for startup childcare in rural areas?
So that's a great question. And it reminds me of something I did not mention, Marcia, is that So in the Farm Bill, if we ever get a Farm Bill, for those of you who follow, in there, for the very first time, there is the Expanding Childcare in Rural America Act, if that makes it through the final version. And what that does, it was introduced in the same day on the House and the Senate with bipartisan support in 2023. And it actually directs USDA Rural Development to use existing dollars to prioritize childcare in rural communities that are agriculturally important. And so what it does is it takes those existing programs that could be used for building physical infrastructure, or it could be used for training, right? Professional development for childcare providers. So it's a really, and especially, you know, this group knows how to deliver technical assistance also remotely, right? So especially for folks who are living in rural areas, what are some of the innovative ways that we can work on professional development with childcare providers? Also knowing that in rural areas, it may not really be center-based care is not necessarily going to be the solution because of the numbers and the hours. So how do we also really work on providing resources and support for in-home care based providers? So if we get a Farm Bill, that will be in there. I think that there's just a lot of changes right now within the federal government that there's a lot of unknowns. I will say it was interesting that was also an issue that both Farm Bureau and Farmers Union went in hand together. They said that this was the issue that they felt was as important, and it was just like when they went hand in hand for opioids. So it's very much also connected. Like these are some of the issues that they're seeing really affect rural America and the ag economy as well. So also on this website, I put up here this osu.edu CCWL, that's the Center for Community and Working Landscapes. And that's where a lot of the research is. So if you're interested in some of those research briefs, like I know folks were interested in some of those data, we have a lot of one-page research overviews and briefs to make it digestible. This is the farm, this one is the farm health insurance curriculum that we're still developing. So there are some resources in there. I'm just waiting to really launch that a little bit more completely once folks test it out. But there are some initial resources on there that you may be able to access as well.
I just have a quick question, something that jumped out to me, and in my experience working with farmers, it was just the fact that so many people wanted to talk about this issue, which tells you how prevalent it is. So do you have any recommendations on how, professionals in the community or just community members themselves can organize to convene spaces, like safe spaces where people can share these ideas or what their experiences are and talk about that and help kind of create solutions around that?
Yeah, that's a really great question. And I think that one of the things that I think that there's definitely an interest, and I think really putting the time and effort into thinking about your facilitation is going to be key, because one of the things that we actually heard from some of the focus group participants is that in their counties, the educator had tried to do this, but it was not well facilitated. And so then there were women and this is mostly women who came to this one, who had very different values around how they were raising their children. So there were some that were, intentionally homeschooling, intentionally integrating children into the enterprise, and really value that. And then there were others who still valued their children, but would talk about them in very disparaging terms. And that was very hard for the person who, when those values felt like it was conflicting, it turned into a negative experience for that person. So I think really thinking about what is the objective, and then seeing if there's a farmer in your community who is willing to be part of that conversation to help facilitate and give space. Because I think one of the things too that happens is that there's a tendency to default into, this is the best thing ever growing up on a farm, which again, it's not to negate that, but there's what they call in the farm safety world, ag exceptionalism. And this is better than everything else. And there's a lot of important reasons for that. But I think, how do we say, like, acknowledging that, but then also coming up with time to acknowledge the hard parts and kind of figure out how do we make solutions that are going to work for us, knowing that they will be imperfect.
Thank you. That's helpful.
It's a hard question. And I think it's something that's actually challenged our team to really think about, because when people ask us that, it's not a simple answer that I wish it was. And that's where the curriculum, as we train it out, that might be tools in there that you could use as part of your facilitation techniques too.
I am going to drop into the chat. I don't know if that's going to work. It looks like that's just a picture. Oh, you got the link. Okay. I'm dropping into the chat. This is a post-event survey. I just want to get that in before any folks have to drop off. You're welcome to continue asking questions. This is a great discussion. But the feedback is really important for us to better understand what other issues are coming up that we can address in our future events as well. So just making a note of that real fast. And we will be sending out recording for this session, as well as I mentioned the information, the toolkits that we collect around this topic that we will share out. And for folks who want a certificate of attendance, we will also include that. So just a quick follow-up on what you can expect. Will there be any follow-up sessions? So not specifically based on our work to this issue. We will have other events. But Shoshana, are there any sessions that you know of that you can share that might be happening?
So I'm wondering if, I guess, two things. One is when we're ready to release the training nationally, we could certainly disseminate it through your network so that folks have the opportunity to take that. And then also we are, for anybody in Ohio, we are talking about having a specific Ohio focused training as well. So those are two things that we're happy to disseminate through the network.
Wonderful. And is that training for professionals who work with farmers?
Yeah. And one of the things that we actually encourage folks to do is to come as somebody from the ag and natural resource side and somebody who is either family consumer science or community development and work in teams. And they don't have to be just from extension. They can be from the nonprofit sector. They can, there's a whole variety. And especially as we open it up, we're welcoming everybody as we learn more.
That's great. Yeah, I know we've got some folks from Rural Action and they do good whole farm planning work there. So wonderful. Yeah, we look forward to learning more about that. Any other questions for Dr. Inwood before folks hop off? Or comments? All right. Well, thank you so much. We appreciate hearing about all this really important research and action items that we can take into our communities. So thank you so much for being here.
Thank you so much for having me, and thank you for all the good work you all do.
Yeah. Thanks, everybody.
Thanks. Have a good one.
And I hope you're not flooding there, Katie.
Yeah, I don't know. I haven't looked out the window, so
Okay.
we'll see.
We'll be safe.
Thank you. Bye now.
All right. Bye-bye.